Speech therapy is a type of healthcare that focuses on improving communication skills. It helps people who have problems speaking clearly or fluently. It also helps people who have trouble understanding language, which is crucial for effective communication. Speech therapy can help people of all ages, from young children to older adults. Babies, children, and adults can all benefit from speech therapy, regardless of their age or the severity of their issues. Speech therapists teach people how to make sounds correctly, which is essential for clear speech. They show people how to use their mouths and tongues correctly to produce the right sounds. Speech therapists also teach people how to understand and use language effectively in their daily lives. This includes teaching grammar and vocabulary, which are fundamental components of language. Speech therapy is important. It helps people communicate better, making it easier for them to express their thoughts and feelings. This can significantly improve their quality of life, as effective communication is key to many aspects of daily living. People who can communicate well have better relationships with family, friends, and colleagues. They may also have more success in school and at work, as good communication skills are highly valued in both settings. Many different problems can be helped by speech therapy. These problems can affect people of all ages, from young children to older adults. These are called speech and language disorders. They can vary widely in their nature and severity. One common disorder is stuttering. Stuttering can make it difficult for a person to speak fluently. Stuttering is when someone repeats sounds or words. This can cause frustration and embarrassment. Another common disorder is articulation disorder. This affects the clarity of speech. This is when someone has trouble saying certain sounds. It can make it hard for others to understand them. Language disorders can also occur. These disorders impact the ability to understand or use language. A child with a language disorder may have trouble understanding what others say. This can affect their learning and social interactions. They may also have trouble putting words together to form sentences. This can make communication very challenging. Some people have voice disorders. These disorders affect the sound of the voice. This is when there is a problem with the way their voice sounds. Their voice may be hoarse or breathy. This can make speaking uncomfortable or difficult. Swallowing disorders are also treated by speech therapists. These disorders can be very serious. These disorders make it hard to swallow food or liquid. This can lead to nutritional problems and health risks. Speech therapists work with people of all ages who have these disorders. They provide essential support and strategies. They help them communicate and swallow safely. Their work improves the quality of life for many individuals. Speech-Language Pathologists, or SLPs, are the experts in speech therapy. They are trained to assess and treat speech and language disorders. SLPs work in many different settings. You can find them in schools, hospitals, and private clinics. SLPs work with patients and their families. They develop treatment plans to meet each person's needs. They teach exercises to improve speech and language skills. SLPs also counsel families on how to support their loved one's progress. Section 4. Speech Therapy for Children. This section will explore the importance and benefits of speech therapy for young ones. Speech therapy is crucial for children as it aids in their overall development. It helps them develop strong communication skills, which are essential for their future. Children with speech and language disorders can benefit greatly from these sessions, making noticeable progress. Early intervention is key for the best outcomes, as it can significantly improve a child's ability to communicate. Speech therapists use fun and engaging activities in therapy sessions to keep children motivated and interested. They may use games, songs, and stories to target specific sounds and speech patterns. They may also use pictures and objects to help children understand and use language more effectively. Speech-language pathologists work closely with parents and teachers to ensure consistent support. They provide strategies to support a child's progress at home and at school, creating a comprehensive approach. The ultimate goal is to help the child communicate effectively in all environments, whether at home, school, or in social settings. Section 5. Speech Therapy for Adults. Adults can benefit from speech therapy too. Stroke or brain injury can affect speech and language. Speech therapy helps adults regain lost skills. They may relearn how to speak, understand language, and even swallow. Speech-language pathologists tailor their approaches to each adult's needs. They may use exercises to strengthen muscles. They may also teach strategies to improve communication. Speech therapy can be life-changing for adults. It can help them regain independence and improve their quality of life. It can also help them return to work or social activities. Section 6. Benefits and success of speech therapy. Speech therapy has many benefits. It improves communication skills. It can also boost self-esteem and confidence. Speech therapy can lead to better relationships and social interactions. The success of speech therapy depends on many factors. The type and severity of the disorder play a role. The individual's motivation and effort also matter. With dedication, speech therapy can be highly effective. It empowers individuals to overcome communication challenges. It helps them live fulfilling lives.